I'm Dr Yinka. I'm a medical doctor with a passion for skincare. I have 4 products. One of the products is the glycolic acid wash. Glycolic acid is an alpha hydroxy acid that's good at evening out the skin tone, reducing acne, and getting rid of impurities. So if that's something that you're worried about, then an alpha hydroxy acid like a glycolic acid wash is the best thing for you. There's also an SPF, sun protection, which is an SPF 50, something you can use every day of the year, during rain, in the sun, on the beach, and it will protect you from sun damage. It will help to prevent hyperpigmentation. It will help to reduce sun damage, lines and wrinkles, and it's a good moisturizer as well. So you don't need anything else when you use the SPF 50. Then there's the vitamin C serum, which is a 20% vitamin C serum. And what vitamin C does for you is that it gives you that glow, makes your skin pop, and helps to protect you from the sun as well, and also reduces the signs of aging. And the last product is our retinol, which is a 1% retinol, so it's quite a good strength of retinol, and it reduces lines and wrinkles, it reduces acne, it prevents breakouts, and also helps to even out skin tone. So they all work together to give you amazing skin, or you can use whatever one you think you need, or whatever your skincare needs are at the time.
May I ask a question about hyperpigmentation? How can we clear it?
Okay, so the question about hyperpigmentation is a really good one. First of all, we need to remind ourselves what causes hyperpigmentation and what they are. Hyperpigmentations are dark patches. So like when you have a scar, if you have acne, you cut your skin, you get burned by something, then you can develop hyperpigmentation. Actually, hyperpigmentation is the commonest way black skin heals. So you hurt your skin and then you leave dark marks behind. So the first thing to do is try as much as you can not to get hyperpigmentation. So if there are things you can do to prevent it, that's the first thing. The second thing is sun protection is so important, because you will find that you get dark patches in the areas the sun hits your skin. So if you're a driver, you're sitting in a car and the sun comes from this way, you'll find you get more dark patches in those areas. Then things like shaving as well, cuts, treat those things quickly so that they don't leave dark patches. So sun protection is a good one. Another thing is vitamin C. Vitamin C is very good at healing wounds so that it doesn't leave a scar. When the scar has stayed, or when the dark patches have stayed, there are things you can do to help to lighten it. Things as strong as hydroquinone can help. That needs to be under a doctor's direction. Don't just use it on your own. It can destroy skin. There are other things we can use as well. Vitamin C, like I said, licorice, nicotinamide. There are lots of products you can use. So seek help early. It can be treated, it can be helped, but most importantly, try to prevent it if you can.
Can you explain a bit more about SPF?
Okay, so this is a really good question about SPF, and if we need SPF, and if we should be using SPF, and if we need to use SPF every day. So SPF stands for sun protection factor, and you can get a range. So you can get like 15 to 30 to 50 to 90 to 100, And it's really important, is the basis of your skincare. If you do nothing every day on your skin, put sun protection. Like, don't even put moisturizer, put sun protection. Is that important? It's the one thing that you have to put on your skin, because most of the damage to our skin comes from the sun. It causes the dark patches, the hyperpigmentation, it causes the aging, the lines and wrinkles. That you can change, that you can affect. And also remember about skin cancer as well. So SPF will reduce your risk of skin cancer. So it's so important. It's like the most important product of the range, the DYS range. Use an SPF every day. No dermatologist, no specialist you would ever speak to will tell you that that's the least thing to do. They will tell you you need one every day. It will protect your skin. Yeah. every day, even on cloudy days.
What's the best kind of skincare routine to have on a daily basis and can our skin become accustomed to it?
Okay, so there are two questions. The first question is about skincare routine. What's the right skincare routine for you? And the second question is about our skin getting used to particular products. Why does it happen and what we should do about it? A good skincare routine should include something to take off the dirt from your face, take away impurities, and you can use things with alpha hydroxy acids to take away impurities, and then it should include sun protection every day, like I always say is important. If you need hydration, then you can use something to hydrate your skin, where people would call it a moisturizer or a hydrator, and also use an anti-aging. You should be able to start from your 20s to start thinking about anti-aging, so use that every day. You can also modify the regimen based on what your skin needs at the time. But basically, something to take away impurities, sun protection, and anti-aging, or something to hydrate if you need that. The second question is about why does our skin get used to a particular product or doesn't respond as well as after a while. It happens with everything. So in medicine, in science, it happens with everything. So we will talk about antibiotics resistance, for example. When you take antibiotics for a long time, your body doesn't respond to it as much. Shake things up. Once you know this is what this ingredient does for my skin, then you know how to shake it up. You know that vitamin C gives me a glow. Maybe niacinamide also does that. So I'll use vitamin C for 6 months or a year. And next year, I'll go to niacinamide. Or I'm going to carry on with my retinol. Retinol, I always say carry on with anyway, even when you're not seeing what it's doing, because it slowly reduces the signs of aging. So carry on with that. Don't give up. You can slow down. You can go down to once a week, then go to twice a week, or every day, then back to once a week. Just change it up. But once you know what the products are, what the ingredients are, what your skincare needs are, then you can shake things up. Don't be afraid to shake things up. Just always use things that work. Don't use something because it smells good, it looks good. My friend said this. Ask what's in there, what's the active ingredients? Is it retinol? Am I getting an alpha hydroxy acid? Just know what's in your product and then be confident of using it.
My question is about ingrown hairs and the best way to avoid them.
Okay, that's a great question because my husband worries about it as well. And ingrown hair is like the curse of the curly hair. So if you've got curly hair, it can happen because the hair wants to grow out straight, but because it's so curly, it can curl on itself backwards and it gets clogged up and it becomes inflamed, it becomes infected, it's painful, it doesn't look good. What can you do? The first thing is to try and prevent it. If you can grow a bushy beard, that would be amazing, first of all. But if you can't, then the shaving, like dry shave is better, yeah? Dry shave in the direction of the hair. If you can see how your hair is growing and if you shave in that direction, then that's good. Then after you've shaved, the things you can do, if you use things with alpha hydroxy acid, sounds like big words, but it's basically a glycolic acid, for example. Because they break down the pores, the comedones, they keep them open so that all the gunk that's blocked it comes out, so it doesn't get blocked. And also the other thing the glycolic acid will do is the dark patches you get after shaving, that will help with that as well. Also retinol has been known to help with ingrowing hair because it's like an anti-inflammatory as well. It will help with that, it will help with the dark patches. So the first thing to do is think about how to prevent it from happening with the way you shave, with the kind of shaving. For women, for example, I would say they should have laser to get rid of the hair. If they don't need it, especially on the face, they can get rid of that hair. But for men, dry shave in the direction of the hair and then use an alpha hydroxy acid later to just stop the inflammation. If it ever gets infected, then you need antibiotics. So you need to be speaking to a doctor to get treatment with antibiotics, which can be either tablets or cream. But that's the best way to manage it.